Renal corpuscles. Renal corpuscles is made up of glomerulus and Bowman's capsules. Glomerulus is the tuft of capillary, and Bowman's capsule is having parietal layer and visceral layer. So let us start with our first topic, which is renal corpuscles. Let us discuss the different parts. This has afferent arteriole, which helps in feeding in the glomerulus, and the blood, after getting filtered into this glomerulus, comes out through efferent arteriole, which takes the blood away. This afferent arteriole has special type of cells called juxtaglomerular cells. These are pressure receptors. These have baroreceptors and mechanoreceptors, which sense the changes in the blood pressure and stretch and secretes renin. This renin serves to regulate the blood pressure. The distal convoluted tubule has another special type of cells called macula densa cells, which has chemoreceptors. This chemoreceptors present in maculodensa cells of DCT, and the baroreceptors and mechanoreceptors present in juxtaglomerular cells of afferent arteriole are together called as juxtaglomerular apparatus. The glomerulus has a special capillary bed, which is called as fenestrated capillaries. The term fenestration itself tells that there are holes or pores in it, and which has the diameter of 50 to 100 nanometers. That means any substance which is less than this can easily pass through this capillary bed. This podocyte clings to the glomerular capillary, and this forms the visceral layer. The other layer is parietal layer. This parietal layer is continuous with the visceral layer. The glomerulus follows to the next part, which is proximal convoluted tubule, which is made up of cuboidal epithelial cells. In the glomerulus, the blood enters through afferent arteriole and moves out through the afferent arteriole. The rate at which the blood flows through the artery is 1,200 milliliters per minute, of which 575 milliliters per minute comes out through efferent arteriole, and the remaining is filtered, which is 625 milliliters per minute, of which only 20% is filtering through the glomerulus and reaching the proximal convoluted tubule. This Bowman's capsule has two layers, a parietal layer and a visceral layer. The glomerulus has the basement membrane, which is made up of three layers: endothelial cells, lamina densa, and podocyte cells. This layer only allows particle size of less than 50 to 100 nanometers. The next layer is filtration slit. Filtration slit will allow the particle size of less than 25 to 30 nanometers. This is nephrine, which is a special type of protein, which allows a particle size of less than 7 to 9 nanometers. This glomerulus has fenestrated capillaries, which have the fenestration pores in it. The layer in the inside is negatively charged, which is called the lamina rana interna, which is made up of heparin sulfate. Let us say albumin, which is negatively charged, gets rippled due to the negative charge of the layer. The blood products like RBC, WBC, platelets, the formed elements cannot pass through the fenestrated pores, whereas the small protein, water, electrolytes, nutrients can pass through if the particle size is less than 100 nanometers. The afferent arteriole has some special type of cells called juxtaglomerular cells. These juxtaglomerular cells have baroreceptors, which can sense the blood pressures, and this produces renin, which is very important in maintaining the blood pressure. There are other substances like magnesium, sodium, calcium, potassium. All these have positive charges, which get filtered through the glomerulus. Here, the glomerular filtration rate is the rate at which the components of the plasma are getting filtered. 1,200 milliliters of blood is entering in 1 minute through afferent arteriole, of which 625 milliliters of blood per minute is being filtered, and the rest is being taken out through efferent arteriole. So of this 625 milliliters, only 125 milliliters per minute is being filtered and entering proximal convoluted tubule. There are different pressures playing roles, like the glomerular hydrostatic pressure, colloidal osmotic pressure, capsular osmotic pressure, and capsular hydrostatic pressure. The glomerular hydrostatic pressure helps in pushing the plasma components out of the capillaries. This pressure is 55 millimeter per mercury. The colloidal osmotic pressure. The plasma proteins here are trying to keep the water inside the bloodstream. This is 30 millimeter per mercury. The capsular osmotic pressure is 0 as there is no leakage of any of the proteins. The other pressure is capsular hydrostatic pressure. Here the pressure gets built up in the Bowman's capsule, and this then backflows, pushing the fluid back into the glomerulus, which is 15 mm per mercury. Let us now see the next part, the factors affecting the glomerular filtration rate. Factors affecting the glomerular filtration rate. The first part is the net filtration pressure, which is directly proportional to the glomerular filtration rate. This is the pressure forcing out the plasma components minus the pressure trying to pull in the plasma components. Let us see in the formula, glomerular hydrostatic pressure plus capsular osmotic pressure minus colloidal osmotic pressure plus capsular hydrostatic pressure, which is seen in the picture. After the calculation, the net filtration pressure, what we get is 10 mm per mercury. The glomerular hydrostatic pressure is directly dependent to your systemic blood pressure. If the BP increases, the glomerular hydrostatic pressure increases. If the BP decreases, the glomerular hydrostatic pressure decreases. The colloidal osmotic pressure is due to many different types of proteins, like in multiple myeloma. More proteins hold up more water, and if there are less proteins, there will be less water, which decrease the pressure. The capsular hydrostatic pressure can be due to the renal calculi, which gets stuck up, and this builds up the pressure, which increases the pressure. The other factor which affects the glomerular filtration rate is the surface area of the glomerulus and permeability of the glomerulus. Both are directly proportional to the glomerular filtration rate. The surface area of the glomerulus, like if the surface area is small, there will be less glomerular filtration rate, and if the surface area is large, the glomerular filtration rate will be more. Conditions like diabetic nephropathy, deposition of proteins in the glomerular bed making it thicker, will decrease the surface area, which eventually will decrease the glomerular filtration rate. Like the permeability of the glomerulus, if the permeability increases, the glomerular filtration rate increases, and if the permeability decreases, the glomerular filtration rate decreases. For example, conditions like glomerular nephritis. This destroys the basement membrane, which makes it very porous, and then the glomerular filtration rate decreases due to inflammation, swelling, and even if the basement membrane is more porous, still the glomerular filtration rate decreases. Here, the surface area of the glomerulus and the permeability of glomerulus together are called the filtration coefficient, denoted as Kf. So in general, the glomerular filtration rate is equal to the net filtration pressure multiplied by the filtration coefficient.